Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide leading education and commentary on injuries, injury treatments, injury prevention to help athletes and active people, much like yourself, to stay healthy and perform your best. And one of the most challenging injuries that I take care of are ACL injuries. And I see, people, from, their mid-40s all the way down to teenagers, and lots of teenagers that suffer these injuries. And it's devastating. They come in and they hope that it's not a big deal. They find out it's an ACL tear, and a lot of them will even cry. I mean, they know just from having teammates that have it, they're looking at 6 months probably minimum, but it can be a year or more before they get back to play. And that's so much time and effort. They're away from their teammates, and they feel like they don't have control over what happens to them. They can't train harder through it. I mean, basically now they're at the mercy of the injury and a surgeon and a physical therapist. So it's a really devastating injury. One of the ideas that's come about over the last few years is this idea of prehab, and whether or not doing prehab can actually improve your outcomes, maybe even get you back to play faster. Now, what is prehab? Essentially, it's working with a physical therapist for a couple of weeks before a big stressful event, in this case surgery, to try to improve your outcomes. So there's a few points I want to emphasize about prehab that may influence your decision to try it before you undergo an ACL surgery. First of all, we know that after ACL surgery, and really after ACL injury, the knee swells up. It's swollen like a basketball. It's really painful. It's really stiff. And that can be one of the challenges after surgery, is getting rid of that swelling, getting the quad strength back, getting the motion back. And what we think is that if you work with a physical therapist for a couple times a week for a few weeks to get the swelling down, to improve your quad strength, improve your knee motion before surgery, those will get better more quickly after surgery. So in theory, you might be ahead of where you should be fairly early on after surgery, and maybe that carries down the line, but regardless, it can help get those features better. So if you work on it ahead of time, you're probably going to come through the early weeks of surgery a little bit better afterwards. Plus, working with a physical therapist can help you with things that you may not think about. Getting your strength back so maybe you can drive a little bit faster. Can help with going up and down stairs. That doesn't seem like it would be so difficult, but if you're in a knee brace and on crutches, you'll be surprised how hard it is to get up and down stairs. And so working with a physical therapist on that kind of thing before surgery can certainly be helpful. Now, another thing that can be helpful that a lot of times you don't think about, physical therapists a lot of times are really busy in a scheduling sense. They have a lot of patients and they may be booked out several weeks. If you wait till surgery to schedule it, it may be 10 or 14 days before you can get in. But most orthopedic surgeons, I certainly am one of these, like people to work with a physical therapist 4 or 5 days after surgery. So if you work with a physical therapist after injury, before surgery, you can go ahead and set up your physical therapy for after surgery and not get caught in that scheduling dilemma of potentially now you have to wait several weeks. That can have some long effects in terms of stiffness and lack of strength. So the quicker you get in is a good thing. And so working with a physical therapist beforehand can certainly be a good thing. And this last point that I think is really important gets back to what I was talking about at the beginning, how difficult this recovery is. In that first few weeks, again, you're aching, you're uncomfortable, you're stiff, you're swollen, and it's just really challenging, even for high school and college athletes, even for professional athletes. So working with a physical therapist even beforehand can build a camaraderie, can build trust that can really help. That strong relationship can really help in the early weeks after surgery. I usually tell people once you get through the first 6 weeks or so, you're through the worst of it. You still have a long way to go, but it's still, if you get through that, it can be really helpful. So a good relationship with a physical therapist built even before surgery can really help later on. So those are my points about prehab. Obviously, I'm a big fan of it, but what do you think? Have you ever suffered an ACL injury, and did you rehab with a physical therapist before surgery, or do you wish you had? If you are a physical therapist, what do you think about this? Do you encourage it, and what kinds of things do you work on? So leave your comments. I would love to hear them. Leave your comments below this video. I'd love to hear what you think, and I'll get back to you as well. If you like videos like this, I would really love for you to subscribe. I record videos on injuries and injury treatments and injury prevention every week, and so you'll get those delivered straight to you on all sorts of sports and exercise topics. If you know people that have torn their ACL and think this video would be helpful, I'd be so grateful if you'd share this video with them. And last, I share resources on ways to stay healthy and perform your best by email, completely free, and the only way you can get those is through my email list. So go to my website, drdavidgeyer.com, and sign up. You'll get those delivered to you, and they apply whether or not you play team sports or you just like to run or lift weights. They can help you stay healthy and perform your best. Thank you so much for watching. I hope this was helpful, and definitely let me know if there's any way I can help in the future. I look forward to seeing you right here next time.